Did you know there's a common kitchen item in your pantry that can support digestion, improve dental health, reduce inflammation, and maybe even slow the progression of certain chronic conditions? I'm talking about baking soda. Yes, the same stuff you use to freshen your fridge or help your banana bread rise may have a lot more value than most people realize. In fact, some health experts now consider baking soda one of the most underrated natural remedies available. And the best part? It costs just pennies per use. In this video, we're going to explore 13 proven or promising ways baking soda can help improve senior health, from easing heartburn to supporting kidney function to helping fight off colds. We'll also cover exactly how to use it safely, and more importantly, who should avoid it entirely, because while baking soda is powerful, it's not for everyone. Let's get right into it. Health benefit number 1, supports natural detoxification. When dissolved in water, baking soda becomes alkaline, meaning it helps neutralize acid. This can be helpful both inside and outside the body. Many seniors use baking soda baths to help calm itchy skin, rashes, or inflammation. Soaking in a warm tub with just a quarter cup of baking soda can leave the skin feeling soothed, balanced, and refreshed. And while research is still limited, some users report a noticeable reduction in symptoms after a few sessions. But what about internal detox? Some studies have shown that baking soda, when taken in small diluted doses, may help support the body's natural detoxification process, especially for individuals with chronic kidney disease. Baking soda can reduce acidity in the blood and urine, which may improve how the kidneys filter waste. In fact, one study from the Journal of the American Society of Nephrology found that baking soda supplements helped slow the progression of kidney disease in patients with high blood acidity. Still, it's important to note, your body already does a great job managing its own pH balance. So unless a doctor recommends it, using baking soda internally should be done carefully and sparingly. Too much can throw things off and lead to nausea, high sodium levels, or worse. But when used appropriately, baking soda can be a gentle and affordable way to support your body's natural detox systems. Now let's move on to something more visible, your teeth. Because the next benefit is one many of us are familiar with, but few people actually take advantage of. Baking soda can whiten your teeth, freshen your breath, and protect your gums, all without harsh chemicals or expensive treatments. Let's break down exactly how it works and why it's such a powerful option for seniors looking to improve oral health without the cost or side effects of conventional whitening. Let's talk about oral health, because for seniors, keeping your mouth clean isn't just about having a nice smile. It's about protecting your heart, your brain, and your immune system. And that's where baking soda comes in. Baking soda is naturally abrasive, but in a very gentle way. It helps scrub away plaque and surface stains without damaging your enamel the way harsh whitening pastes or acidic mouthwashes can. It also helps neutralize acids in your mouth, acids that come from food, bacteria, and sugar. These acids are what cause tooth decay and gum disease over time. By brushing with a bit of baking soda or adding a small pinch to your regular toothpaste, you create an environment in your mouth where harmful bacteria struggle to survive. That means fresher breath, cleaner teeth, and fewer trips to the dentist, all for just a few cents a week. Some seniors even use baking soda as a mouth rinse. Just dissolve a quarter teaspoon into a small glass of water and swish it around for 30 seconds. It can help calm sore gums, kill odor-causing bacteria, and keep your mouth feeling fresh. Now, should you replace your toothpaste with baking soda? Not necessarily, but using it once or twice a week can be a great way to boost your oral care routine naturally. Just don't overdo it. Daily use might wear down enamel over time. And always consult your dentist if you have sensitive teeth or ongoing gum issues. Up next, let's move from your mouth to your digestive system, because the next benefit is one that many seniors already know about, but maybe don't know how to do properly. Baking soda can provide fast, natural relief from acid reflux and indigestion. Let's break that down. As you age, the muscles at the top of your stomach may weaken. That makes it easier for stomach acid to creep back up into your esophagus, causing that burning, uncomfortable feeling we call heartburn. Most people reach for antacids, but those can come with long-term side effects, especially for seniors. Some reduce nutrient absorption, and others can increase the risk of infections like C. diff. Baking soda, on the other hand, neutralizes stomach acid quickly and naturally. If you're having mild indigestion, dissolving 1/2 teaspoon of baking soda in 4 to 6 ounces of water can bring relief in just a few minutes, but don't use this daily. It's best for occasional flare-ups, not long-term use. And if you're on a low-sodium diet or have high blood pressure, talk to your doctor first. Baking soda is sodium bicarbonate, meaning it does contain salt. You don't want to trade heartburn relief for blood pressure problems. Coming up next, a surprising way baking soda can help soothe itchy skin, rashes, and minor burns, all without creams or prescriptions. Let's talk about something every senior deals with at some point: skin irritation. Dry patches, itching, rashes, and even minor burns can become more frequent as we age. And while there are endless creams and ointments on the market, sometimes the best solution is already in your kitchen cabinet. Baking soda has long been used as a natural remedy for irritated skin. It's inexpensive, easy to use, and surprisingly effective for a number of common issues. For example, if you have itchy skin from dryness, bug bites, or a mild rash, a baking soda bath can help relieve the discomfort fast. Just add 1/4 to 1/2 cup of baking soda to a warm, not hot, bath, and soak for about 15 to 20 minutes. It can help reduce inflammation, calm the itch, and leave your skin feeling more balanced. This is especially helpful for people with eczema, contact dermatitis, or skin that's easily irritated by soap, laundry detergent, or heat. You can also make a simple baking soda paste by mixing it with a little bit of water, just enough to make a thick spread. Apply it gently to itchy spots or minor burns and let it sit for 10 to 15 minutes before rinsing off. Many people use this method for things like sunburn relief, razor burn, or insect stings. The baking soda helps neutralize the skin's surface and calm down the overactive nerves. Just keep in mind, this isn't a cure-all. If the irritation is severe, spreading, or doesn't improve after a few days, always call your doctor. Baking soda is great for minor issues, but it's not a substitute for medical treatment when something more serious is going on. Still, for mild itching or a little skin flare-up, it can work wonders, and you'll skip the chemicals and preservatives found in most store-bought products. Now, let's move from the outside in, because your skin isn't the only thing that benefits from a little balance. So does your urinary system. In fact, the next benefit of baking soda might surprise you. For people prone to urinary tract infections, baking soda may help reduce symptoms, or even prevent infections in the first place. How? It's all about pH. UTIs happen when bacteria grow in the bladder or urethra. Bacteria love acidic environments. Baking soda, when taken properly and in moderation, can help raise urine pH slightly, making it harder for bacteria to thrive. Some seniors report fewer UTI symptoms or less frequent infections when they drink a small glass of water, mixed with 1/4 to 1/2 teaspoon of baking soda, once a day for a few days. But again, this should never replace antibiotics or medical care. It's a supportive remedy, not a primary treatment. Up next, we'll explore how baking soda can help reduce inflammation and pain in the joints, especially for seniors with arthritis. If you're dealing with arthritis, stiffness, or general joint pain, you're not alone. Millions of seniors feel like their body just doesn't move the way it used to. But here's something most people don't know. Chronic inflammation in the body often begins in the gut, and this is where baking soda may help in a big way. Recent studies suggest that small, diluted amounts of baking soda may actually help calm inflammation by signaling the body to shift into an anti-inflammatory state. One study from the Medical College of Georgia found that daily doses of baking soda in water appeared to encourage the spleen and immune system to stop overreacting, essentially reducing chronic inflammation markers throughout the body. This is big news for anyone with rheumatoid arthritis, fibromyalgia, or other inflammation-driven conditions. By lowering systemic inflammation, baking soda may help ease joint pain, reduce flare-ups, and support long-term mobility. Now, this isn't a magic bullet. You still need good nutrition, hydration, gentle movement, and rest. But adding 1/4 teaspoon of baking soda to a glass of water once a day may offer a subtle but meaningful improvement over time. Just be careful. Baking soda contains sodium. If you have high blood pressure, heart disease, or kidney issues, check with your doctor before using it regularly. And remember, more is not better. Stick to small amounts and listen to your body. You can also use baking soda externally for joint relief. Some people find that a baking soda bath, especially with Epsom salt added, helps relax sore muscles and ease joint tightness. The minerals soak into the skin and promote circulation, which can help reduce that stiff, achy feeling after long days or cold weather. Even soaking just your hands or feet in warm baking soda water can give targeted relief. So, whether taken internally or used in a bath, baking soda may be a gentle tool in your fight against inflammation and a great addition to your pain management routine. Up next, we're shifting to respiratory health, because if you deal with sinus pressure, congestion, or frequent colds, baking soda can be your secret weapon, especially when used the right way. We'll show you how to make a simple sinus rinse at home and how to use baking soda to clear your nasal passages without relying on medicated sprays or decongestants. This is especially helpful for seniors who struggle with seasonal allergies or get sinus infections frequently. Let's talk about something that becomes more frustrating with age: sinus pressure, post-nasal drip, and congestion that just won't go away. Whether it's seasonal allergies, dry air, or frequent colds, many seniors struggle to keep their nasal passages clear. Over time, this leads to headaches, poor sleep, and even infections if mucus builds up in the wrong places. That's where baking soda steps in. Mixed with warm water and a little salt, baking soda becomes a natural nasal rinse. It helps flush out mucus, allergens, and bacteria, all while soothing the delicate tissue inside your nose. Here's how to make it safely at home. In a clean cup, mix 1/4 teaspoon of baking soda, 1/4 teaspoon of salt, and 1 cup of warm distilled or previously boiled water. Stir until it's fully dissolved. Then, using a neti pot, bulb syringe, or nasal spray bottle, gently rinse your nasal passages. Lean over the sink, tilt your head slightly, and let the solution flow through one nostril and out the other. Then switch sides. This might feel strange at first, but it can give incredible relief, especially if you suffer from sinus pressure, stuffiness, or chronic nasal inflammation. Baking soda in the rinse helps break down thick mucus and neutralizes irritants. Unlike medicated sprays, it won't cause rebound congestion or dependency. You can do this once a day during allergy season or anytime you feel pressure building in your sinuses. But be sure to always use distilled, boiled, or sterile water. Never tap water. And clean your equipment thoroughly after each use to prevent introducing bacteria. Aside from sinus relief, some people even gargle with baking soda and salt water to soothe a sore throat. The alkalinity helps calm the inflamed tissues and reduce the growth of certain germs. Just be sure to spit it out. Don't swallow it. And if you deal with bad breath or recurring throat irritation, this simple rinse can be a helpful addition to your routine. Now, let's talk about another area of the body that gets ignored: your feet. If you deal with foot odor, cracked heels, fungal infections, or sore arches, baking soda may be one of the best natural remedies you haven't tried yet. We'll show you how to make a simple foot soak that not only refreshes tired feet, but also helps eliminate bacteria and fungus that build up in shoes and socks, especially if you wear slippers, sneakers, or compression socks all day. It's affordable, soothing, and only takes about 15 minutes to start feeling the benefits. Stay with us, because we've still got several more unexpected health uses to cover. If your feet are giving you trouble, whether it's odor, dryness, or discomfort, you're not alone. As we age, our feet go through a lot. Circulation may slow down, skin dries out faster, and small irritations can turn into bigger problems if left untreated. But here's the good news: baking soda can help. A simple baking soda foot soak can do more than just relax you. It can fight bacteria, soothe inflammation, and even reduce fungal growth, especially in the early stages of athlete's foot or toenail fungus. Here's how to make one. Fill a small tub or large basin with warm water, enough to cover your feet up to the ankles. Then add 3 tablespoons of baking soda and stir it until dissolved. Soak your feet for 15 to 20 minutes. While you soak, baking soda helps soften tough skin, pull out odors, and restore a healthier pH level on your feet, which is key to stopping bacterial growth. If you want to enhance the soak, add a few drops of tea tree oil or peppermint oil. Both have natural antifungal and antibacterial properties. It's an easy way to make the soak even more effective and more relaxing. Do this a few times a week, especially if your feet tend to stay sweaty, you wear tight shoes, or you've noticed peeling or itching between your toes. When you're done, dry your feet thoroughly, especially between the toes, and apply a light moisturizer. Keeping the skin hydrated after a soak helps prevent cracking and irritation. Now, let's shift gears to something a little more internal: your energy levels. Many seniors feel sluggish throughout the day. You might wake up tired, feel foggy in the afternoon, or hit a wall after meals. There are many causes, but one overlooked factor is pH imbalance and low-grade inflammation. And that's another area where baking soda may offer a gentle boost. When your body becomes too acidic from stress, poor diet, or dehydration, your cells may not function as efficiently. That includes your mitochondria, which are the tiny energy factories inside your cells. Baking soda, when used properly, can help rebalance your body's pH and support better energy production at the cellular level. Some seniors report feeling less fatigued and more mentally clear when they take 1/4 teaspoon of baking soda in water once every few days, especially if their diet is acidic or high in processed foods. Now, this isn't a replacement for rest, hydration, or nutrition, but it can be a small, supportive step toward feeling more balanced and energized during the day. Next up, how baking soda may help improve uric acid levels, reduce gout flare-ups, and support joint health, especially for those struggling with swollen feet or big toe pain. If you've ever had a gout flare-up, you know how painful it can be. That sharp burning pain in your big toe or ankle? That's uric acid building up in your joints, and it's something seniors are especially prone to. But here's something promising. Baking soda may actually help lower uric acid levels and reduce the risk of future flare-ups. Let's break it down. Gout is caused when your body has too much uric acid, and it starts forming crystals in your joints. These crystals trigger inflammation and pain, especially in the feet, hands, and knees. Baking soda is an alkalizing compound. That means when taken in small amounts, it can help raise the pH of your urine and make it easier for your body to flush out excess uric acid. Some seniors take 1/2 teaspoon of baking soda in a glass of water once or twice a day during the early signs of a flare-up. This may help neutralize the acid and reduce the intensity or duration of the attack. Of course, this isn't a cure, but it can be a helpful, natural tool alongside a low-purine diet, hydration, and whatever medications your doctor recommends. Just be cautious if you have heart disease, high blood pressure, or kidney issues, since baking soda contains sodium. Always check with your doctor before using it regularly for gout. Now, let's talk about one of the most common and frustrating issues seniors face: body odor. Even if you shower regularly and use deodorant, sometimes odor lingers. That's because it's not just about sweat. It's about bacteria on your skin breaking down the sweat. And once again, baking soda can help. Baking soda is naturally antibacterial and odor neutralizing. You can use it as a gentle, homemade deodorant by simply dusting a small amount under your arms or onto your feet. You can also mix it with a little coconut oil to create a natural, fragrance-free deodorant balm. For people with sensitive skin, this works surprisingly well, without the harsh chemicals found in commercial deodorants, which can irritate skin or stain clothes. You can even sprinkle a bit of baking soda into your shoes or slippers to absorb odor overnight. So whether it's managing sweat, neutralizing foot odor, or keeping your underarms fresh, baking soda is a safe, affordable option. Now, we're almost at the end, but there's one more use that might surprise you. It has to do with kidney health. In the final section, we'll explain how baking soda may support kidney function and help slow the progression of certain kidney issues, but only if used the right way. Let's close this out by talking about something serious: kidney health. If you're over 60, your kidneys are already doing more work than ever. They filter your blood, remove waste, and keep your pH levels balanced. But over time, especially with chronic conditions like diabetes or high blood pressure, your kidneys can become overworked. This is where baking soda has shown some promising results. In people with chronic kidney disease, especially those with a condition called metabolic acidosis, the body becomes too acidic. That acidity puts extra strain on the kidneys and speeds up their decline. Researchers have found that a small daily dose of baking soda can help reduce blood acidity, support better pH balance, and slow the progression of kidney damage. One study published in the Journal of the American Society of Nephrology found that patients who took a daily baking soda supplement experienced slower kidney function decline compared to those who didn't. This doesn't mean you should run to the kitchen and start mixing baking soda into every drink. This kind of use should always be medically supervised, especially if you're already dealing with kidney issues. But it's a powerful reminder that sometimes natural substances can help the body heal, or at least support what the body's already trying to do. So to recap, here are just a few of the ways baking soda might help seniors. Supports healthy digestion and reduces acid reflux, freshens breath and strengthens oral care, soothes itchy skin and rashes, calms inflammation and may reduce joint pain, helps balance pH and reduce uric acid in the body, refreshes tired, aching feet and neutralizes odor, clears sinuses and improves respiratory comfort, and may even slow kidney function decline in certain cases. But with all of this said, baking soda is not a cure-all. Yes, it's cheap. Yes, it's natural, but it also requires caution. Seniors should never overuse it, especially those with sodium sensitivity, kidney problems, or high blood pressure. When used wisely, maybe once or twice a week in a diluted drink or as part of your personal care routine, baking soda can be a gentle way to support health without pills, prescriptions, or side effects. So if you found this helpful, don't forget to hit the like button, share it with a friend, and subscribe to the channel. We're posting more senior-focused videos every week, from natural remedies to practical health tips that help you live longer and stronger. And next time you reach for that little orange box in the pantry, just remember, it might be one of the most powerful tools you already own.